Hello, my name is Doris Jackson. I'm the health insurance specialist within the Division of Medical Review and Education at the Centers for Medicare and Medicaid Services. I provide oversight to the Medicare administrative contractors for durable medical equipment to ensure that payment is made only for services that meet all Medicare coverage, coding, and medical necessity requirements. Today I'll be discussing the documentation requirements for physicians or treating practitioners when submitting a prior authorization request for power mobility devices. First, I would like to share that the documentation for power mobility devices has not changed. The current local coverage determination policy explains thoroughly what documentation CMS requires for payment approval. The physician, treating practitioner, and the supplier each play a vital role in facilitating that Medicare beneficiaries receive the correct power mobility device. The physician or treating practitioner is required to conduct the face-to-face examination. This examination must be an in-person visit with the ordering physician or treating practitioner and clearly states the beneficiary's mobility limitations and needs. The face-to-face examination must include a statement indicating the purpose of the visit. For example, the physician must document the patient is present for a mobility examination or the patient is requesting a power wheelchair. The face-to-face examination must also include present medical condition and relevant past medical history. The medical history may include symptoms that limit ambulation, diagnoses that are responsible for symptoms, medication or other treatment for symptoms, progression of ambulation difficulty over time, other diagnoses that may relate to ambulatory problems, distant patient can walk without stopping, pace of ambulation, ambulation assistance currently used, change in condition that requires a PMD, and description of home setting and the ability to perform activities of daily living in the home. The physical examination portion of the face-to-face exam should focus on the body systems that are responsible for the patient's ambulatory difficulty or impact the patient's ambulatory ability. Review of the systems may include the following assessment: height and weight, cardiopulmonary examination, musculoskeletal examination, which will include arm and leg strength and range of motion, and neurological examination, which may include gait, balance, and coordination. Please note, not all elements identified may apply to every patient. Professional discretion is necessary to determine which items are required as part of the face-to-face examination. In addition to the face-to-face examination, the physician or treating practitioner must also write a valid 7-element order for the power mobility device only after conducting the face-to-face examination. The 7-element order must include: number 1, the patient's name; number 2, description of the item to be ordered. Typically, this is written generally. The physician may write something as simple as power-operated vehicle, power wheelchair, or something more specific. The supplier is responsible for reviewing the description of the item to be ordered, then must complete a detailed product description, which must be reviewed and signed by the physician or treating practitioner. The detailed product description must contain the following information: the specific healthcare common procedure coding system codes, a narrative description of the items or manufacturer's name and model number, the physician's signature and date signed, and date stamped to document receipt date. The other requirements for the 7-element orders are as follows: number 3, date of the face-to-face examination; number 4, diagnoses or medical conditions related to the need for the PMD; number 5, length of need; number 6, physician or treating practitioner signature; and number 7, date of physician or treating practitioner's signature. Documentation in the patient's medical record should paint a picture of the patient's functional abilities and limitations on a typical day. It should contain as much objective data as possible. The physician or treating practitioner's documentation should support the medical necessity for the use of the power mobility device in the beneficiary's home.